Good afternoon. Today is February 4th, 2022, and I'm a little bit late in filming and publishing this video. I meant to do this on January 23rd because that was the 2-year anniversary of my amputation, or what amputees affectionately call an Ampuversary. So here we are, I'm in year 2, and in this video I'm going to talk to you a little bit about the positive and negative aspects of my second year as an amputee, and I'm going to answer a few more questions that have been asked about my situation. So starting right off with the positive aspects of my amputation. I just did some follow-up appointments with my surgeons, and basically my limb is healed 100%. Both the Erdl style procedure amputation that I had, all the bone structures, muscle structures, that's all healed 100%. And the RPNI, the nerve work that was done as part of that surgery, that is all healed 100%. So as a result, I do not have any phantom limb pain, I don't have any nerve pain, and I haven't had any reoccurrence whatsoever of CRPS throughout anywhere in my body, either higher in my limb or my opposite side or in other areas of my body. So in all those aspects, this amputation has been a huge success. Now, on a cautionary note, I was informed that my case is still the exception rather than the rule. The majority of people who get an amputation for CRPS still struggle a lot afterwards. Either that CRPS remains in their amputated limb or moves to another part of their body. If it remains in your limb, it makes it almost impossible to successfully wear a prosthesis. So just a word of caution, what worked for me usually doesn't seem to work for the majority of people who are affected with CRPS. Now, what has some of the negative been in that second year? Well, the setbacks that I had in 2022 seemed emotionally and mentally a lot more challenging than they did in my first year. In my first year, I had my surgery, I got fitted with my prosthesis, my limb started healing, began walking again, I did my physiotherapy, I got cleared to work again, and I returned to work. Each one of those was a huge, huge accomplishment and improvement in the quality of my life. In year 2, I basically settled down into everyday life, and any setback I had seemed a lot more challenging to deal with mentally and emotionally. The biggest issue I've had in year 2 is maintaining my physical fitness. As an amputee, and especially as a single leg amputee, it tends to throw your body out of balance. Your amputated side gets weak, your sound side gets a lot stronger. That creates havoc with your hips and with your lower back. And in my case, I lost a lot of flexibility in my lower back, and I still have a lot more strength work to do in my core to make sure that my back, namely my SI joint, doesn't flare up on me. So I'm still doing a lot of maintenance work with that. I foolishly thought that my physiotherapy program, once it was finished, I was done with it and I just carry on with life. That's not the case at all. That high level of activity that you have at the end of your physiotherapy program, you basically have to maintain that for the rest of your life. So it's really important to stay as physically fit and as physically active as you possibly can after your amputation. You can never take a day off. Now, on the topic of strong leg versus weak leg, we did some measuring today. And to give you an idea how big of a difference there is between the two sides, on my left leg, the circumference of my thigh, midpoint between my knee and my hip on my left leg, is 52 centimeters. That's 20.5 inches in circumference. On my right thigh, it's only 46.5 centimeters, or 18.25 inches. And of course, the big difference is in my calf. My left calf has gotten substantially stronger, and it has a circumference of 39.5 centimeters, or 15.5 inches, whereas my right calf has atrophied a lot, due to the prosthesis and obviously lack of movement, it is only 29 centimeters in circumference, or 11.5 inches. Now, someone asked, what is the actual length of my residual limb? So from the top of my tibia to where the bone was cut was exactly 6 inches, or 15 centimeters. And that changes depending on the patient's size and the reason for their amputation. I had a lot of healthy tissue here on my upper calf, so I have a relatively long residual limb below my knee. Now, another question was, what originally caused my CRPS? Well, there's two things that happened. When I was a kid, 15 years old, I had an osteochondroma, a non-cancerous tumor that was removed from my lower thigh. It was basically right behind my knee. That tumor, even though it was successfully removed and it was non-cancerous, created a lot of vascular and nerve damage in my lower right leg. Fast forward to 2011, one night at work, a loading ramp fell on the outside of my foot. And even with safety footwear, it did not break any bones, but it created a lot of soft tissue and ligament damage on the top of my foot and in my ankle. Now, the actual symptoms of CRPS didn't start creeping up until about 2015, when we noticed a lack of range of motion, the swelling, and the redness that's characteristic of CRPS. From 2015 onwards, that condition just got worse and worse and worse. Even such, the actual diagnosis of CRPS officially didn't happen until 2019. As soon as that diagnosis became official, all sorts of treatments it was fast-tracked as to what we could do, whatever we could do to try to improve my foot and save my foot. Underwent a series of injections and procedures to try to regain mobility and proper feeling in my foot. None of that worked, and in August of 2019, the decision was made as a team between my orthopedic surgeon, my plastic surgeon, and myself that an amputation, a specialized amputation, would be the best way to restore my life. Now, that does not happen in a majority of CRPS cases. Amputation does not solve the pain. The majority of cases, that painful foot still remains after surgery, or the CRPS spreads to an area higher up in the limb or the opposite side of your body. So that's just a cautionary tale to anyone who is considering an amputation for CRPS. So what do I have planned for the rest of 2022? Well, as the weather improves, I'm going to be getting out there and doing a lot more adventures. There's some posted on my channel here that you can see places that I've gone, either in my prosthesis or in my truck or on my crutches. Those videos are posted, so have a look at them and we'll see what else I can post for 2022. Alrighty guys, take care.